generator. This instructional video is intended to give the viewer an overview of the functionality and potential uses of the phantom limb generator, created by the Institute for Technological Antagonism, Division of Applied Chaotics. Part 1. Overview. The phantom limb generator is a perspective disrupting device. It consists of a construction-grade 12-ampere motor, which turns a 12-inch diameter fine-cut circular saw blade at approximately 5,300 revolutions per minute. The saw apparatus uses ball bearing mounts to slide on rails. The carriage is actuated by a motor-driven lead screw. The phantom limb generator disrupts perspective by 1. Presenting the user with previously unconsidered choices. 2. Inconveniencing the user via amputation. 3. Causing the user intense pain and blood loss. And 4. Allowing the user to experience the phenomenon known as phantom limb. Part 2. Using the phantom limb generator. It is advisable that the user has a comfortable chair in which to sit, as he or she will likely experience a significant amount of shock. It is further advised that the chair be one that is not easily fallen out of. Make a note of your location's address and place it where it will be easy to read. Take additional care to make sure your doors are unlocked so that emergency personnel can enter more easily. Operation. Step 1. Approach the device. Note that the user is wearing a red shirt. That's smart. Step 2. Roll up the sleeve of your shirt past the elbow. Choose which arm you wish to use. Step 3. Sit in the chair facing the phantom limb generator. Make a note of the surroundings. There is a key switch that arms the device. Put the key in the switch. Do not arm the device yet. Step 4. The phantom limb generator includes a package of zip ties to be used as a tourniquet. Place a tourniquet around your arm, approximately 3 finger widths from the inside of your elbow. The tourniquet should feel tight enough that your fingers begin to feel numb. It should not keep your arm from fitting inside the tube. Step 5. Put on the included safety goggles. Always wear safety goggles to protect your eyes from flying debris. Step 6. Place your arm inside the tube up to the elbow. At the end of the tube, your hand will encounter a pistol-type grip, and you should notice a trigger switch. Feel free to pull the trigger. As long as the key switch is inactive, nothing will happen. At this point, you may find that your perspective has been sufficiently disrupted and that you do not need to continue further with the procedure. In this case, you may remove your arm from the tube and contemplate whether this makes you a coward. Step 7. Should you elect to continue, turn the key switch to the active position. The status panel will indicate that the system is now active and that the trigger will initiate the sequence. Step 8. Take a deep breath. Pull the trigger. A pump will begin to spray an iodine solution on the saw blade to maintain a sterile envelope. The saw will turn on. Soon after, the lead screw will engage and the saw carriage will advance across your arm, severing it. This is likely to cause you significant discomfort. When the saw carriage returns to its original position, the saw will turn off. Step 9. The device will now dial the emergency hotline. When the operator answers, inform him or her that your arm has just been severed and that you are bleeding to death. Your tourniquet has likely restricted blood flow, but they will come faster if they believe you are dying. The operator will ask your address. You may not remember it, as you are likely to be in shock. Read the address to him or her from the note you wrote earlier. You may unroll your sleeve now and use it as a makeshift wound dressing. If you are wearing a red shirt, blood stains will be less visible, decreasing psychological trauma. When emergency personnel arrive, inform them that your severed limb is in the receiver tube. The receiver tube is red and has graphics to convey that it contains biological material. Quick release latches enable a paramedic to easily remove the tube for transport and will protect the severed limb en route. You now have the opportunity to decide whether or not you wish to have your limb reattached. It is important to communicate clearly with medical personnel. Doctors are your friends. There are a variety of applications for the phantom limb generator, including enhanced realism in Civil War or pirate reenactment, prosthetic upgrade preparation, administration of Sharia law, ease of suffering related to body integrity identity disorder. Thank you for watching this instructional video. We hope this provides you with a fuller understanding of the use and application of the phantom limb generator. The Institute for Technological Antagonism strives to remain at the forefront of disruptive coping technology for the next millennium.